Hello. Let's talk about a CAT scan today. A CAT scan stands for a computerized tomography scan. What is that? Was basically is a sophisticated X-ray. And this is done for diagnostic purposes. So if your doctor needs to see if there's something going on, he's going to ask for a CAT scan. And this is the typical big round machine. So you're going to lay down. You're going to be wheeled into a machine. This is usually more open than an MRI. There are MRIs that are open, but it is more open than an MRI. It is usually a quick procedure. So you may be in and out of the room in 15 minutes. You're going to hear a buzzing noise. It's not nearly as loud as an MRI. Usually people are concerned about noise level. It is an MRI that is louder. And what causes the sound in a CAT scan is the actual sort of like buzzing of the X-rays that go inside. What is going to take are pictures, sort of like cross pictures by the X-rays of the inside of your body. This is, like I said, for diagnostic purposes. It can be done basically on any part of your body. And many times your doctor may recommend that it's done with contrast. What is contrast? Contrast is a liquid, usually nuclear liquid, that it is put into your body through an IV, part of your arm. So this is prepared before the procedure starts. The nurse or the technician will come in. She will put in the IV. And then there will be pictures done before the IV is injected, before the fluid is injected, and then after. So there's sort of like a before and after. And then you'll be done. Usually what people have talked about when the injection of the contrast happens is that you may feel warmth throughout your body. You may feel like you have urinated in yourself. This actually does not happen. You may feel some warmth in your throat. So there are things that you may feel. Obviously, if it's something really strong, you need to speak up. But usually it's very tolerable. And it passes very quickly. You should drink a lot of water after the CAT scan, just so that your body gets rid of the fluid. The fluid is injected to get a clearer picture in the CAT scan, so that because it's like you become glowing. Your body glows with the fluid, basically, to put it mildly. So that is the CAT scan. I had a CAT scan yesterday. That's what reminded me to do this video. I had it off my head so that they could see if there were any issues. For example, you could see if there's a hemorrhage in your head and there are any bleeds. That's an example. You could see if your ventricles, the inside of your ventricles, if they have been enlarged, and they compare them with many times with a CAT scan that has been done before. Another important point with a CAT scan is that, don't forget, these are X-rays. So you are getting radiation. It's minor, but you're getting radiation. So CAT scans are not a diagnostic tool that you should be getting every other day. Let's put it that way. You should keep in mind as a patient that this is a diagnostic tool that should be selective. So you shouldn't be getting this, even once a month. It should be spaced out. In case there is a real issue, then your doctor will probably move on to an MRI, magnetic resonance imaging, because that has obviously much less, actually no radiation. So be aware that CAT scans do carry that issue. It's not enough that anything is going to happen to you. Please don't be concerned that if you get a CAT scan, you're going to get cancer. No, that's not the issue. What I am saying is that throughout your life, you do want to be aware that, this is not something to have repetitively. Just keep that in mind, a side thing. So I hope this has been helpful. If it has, do the magic thing, subscribe, press like, and don't forget to hit the bell so that you don't miss any future videos. I hope that you're having a CAT scan. Everything goes well. Bye bye.